Hi friends, this is Dr. Harsh. We are going to speak today about laryngeal cancers or throat cancers as we commonly call it. So what are laryngeal cancers or hypopharyngeal cancers? The larynx is basically nothing but the voice box. It consists of a cartilage right in the middle of the neck, and within this voice box is enclosed our vocal cords and some soft tissue. When the vocal cords move, they produce voice. And this entire apparatus is situated within a cartilaginous framework. Just on the sides, we have the hypopharynx, which is basically the food passage. So, the passage for air, that is the voice box, it's actually the upper part of the trachea that connects down to the lungs. That and the pharynx, which is the upper part of the food pipe, these are very closely situated and they have a lot of common anatomical boundaries, which is why we commonly term this area as laryngopharynx. Now, unfortunately, because of because of smoking or tobacco and other habits, laryngeal cancers of this region are quite commonly seen. So, what are the symptoms? If it is a tumor involving the larynx per se, the larynx again can be divided into three parts: the supraglottis, glottis, and subglottis. So, commonly, if it is a tumor which involves the vocal cords, the glottis, the first symptom that a patient will have is a change in voice. The voice will not be as normal as before. There might be a slight change which gradually will increase over a period of time, and then it will become evident to the family members, and all the people at work will start saying that your voice is husky or your voice quality has changed. The person will not be able to talk loudly in a louder voice. So all these changes will happen. As the cancer spreads, suppose it's a cancer of the voice box, starts from the vocal cord, as it increases in size, as it grows above, the volume of the tumor will cause a partial obstruction to the air column, to the airway, and we will have breathing difficulty. So the patient will slowly complain of breathing difficulty. Doing any kind of heavy work will be difficult, climbing stairs or running or anything. And after a point of time, when the tumor critically narrows down the airway, there will also be noisy breathing, which we call stridor. Now, if the tumor spills into the pharynx, or if tumor starts in the pharynx, then the first symptom will be difficulties in swallowing, pain during swallowing, and person will have a reduction or a decrease in food quantity. The quantity of intake will reduce because of the pain and the difficulty. And once the vocal cords are also involved and they are not able to move well, whatever food we take will get aspirated into the larynx and there will be a cough. So, difficulty in swallowing, and then progressively the patient will have aspiration or have a cough after taking liquids or solids. So, these are the common symptoms of a laryngopharyngeal growth. Now, how do we manage? The first thing whenever a patient comes to us with this symptom is we do an endoscopy in the OPD itself. Nowadays endoscopies are done in the clinic itself. You can either have normally a fiber optic cable which we pass down the nose, or we have a Hopkins examination system which we put through the oral cavity, and we can check the back part of the throat, the larynx, the pharynx, everything can be checked. And that is the first evaluation we do. Followed that, we do a CT scan, sometimes an MRI, and then we have to do a biopsy. Normally this biopsy is usually done under a short anesthesia procedure in the OT. And when we are doing this biopsy, we also do a mapping of the entire space. We check how much the tumor is, where all it has spread, and if surgery has to be done, what kind of surgery is needed.